Hi everyone, welcome back to my channel. In today's video, we will see some important repeated questions from coding guidelines and compliance and regulatory. This is very helpful for your CPC exam. Let's start with coding guideline questions. First question, specific coding guidelines in the CPT manual are located in. So they're asking where the specific coding guidelines in the CPT manual are located, whether it is in the index, introduction, the beginning of each section or appendix A. Do you know the right answer? The right answer is option C, the beginning of each section. The term that indicates this is the type of code for which the full code description can be only known if the common part of the code, that is description preceding the semicolon of a preceding entry, is referenced. Option A, standalone code. Option B, indented code. Option C, independent. Option D, add-on code. And the right answer is option B, indented code. For example, the code 00522 is an indented code and the code 00520 is a parent code. So this indented code, that is 00522, is the type of code for which the full code description can be known only if the common part of the code, that is description preceding the semicolon of a preceding entry, is referenced. For example, the code 00522 is for needle biopsy of pleura. Okay, but the full code description will be anesthesia for closed chest procedures, needle biopsy of pleura. Next question. Which punctuation mark between codes in the index of the CPT manual indicates a range of code is available? So the right answer is option D, hyphen. Question. Which of the following is most accurate about the designation separate procedure? The procedure is, you can read the options. The right answer for this question will be option D, all of the above. Next question. Unbundling a code is option A, unwrapping a code to open a new code. Option B, listing multiple procedures, services and supplies with their own separate distinct codes. Option C, using one code to report a variety of services. Option D, using a new code to report previous services. And the right answer is option B, listing multiple procedures, services and supplies with their own separate distinct codes. Let us move on to compliance and regulatory questions. So the first question, this document is a notification in advance of services that Medicare probably will not pay for and the estimated cost to the patient. Option A, waiver of liability. Option B, coordination of benefits. Option C, advanced beneficiary notice. Option D, UPIN. So this is an important question. The answer is advanced beneficiary notice. Next question. The RBRVS is option A, payment reform implemented in 1992. Option B, listing of customary charge for services. Option C, payment list that indicates the prevailing charge in a locality. Option D, listing of physicians' individual charges for a service. And the right answer is option A, payment reform implemented in 1992. The full form of RBRVS is Resource Based Relative Value Scale. Next question. This entity develops and publishes an annual plan that outlines the Medicare monitoring program. So, the right answer is option C, OIG, that is Office of Inspector General. Next question. What is a NPI? So, they're asking the full form of NPI and the right answer is B, National Provider Identifier. Which of the following is not considered fraud or abuse? Option A, lack of documentation of medical necessity for services reported. Option B, accepting a $20 gift card from a shoe repair representative for each Medicare patient referred to his store. Option C, referring patients to a radiology center in which a physician is a partner. Option D, going to lunch with a pharmaceutical representative. So among these options, which is not considered as a fraud or abuse? And the right answer is option D, going to lunch with the pharmaceutical representative. So that's it for today. Don't forget to like, share and subscribe my channel CodeMed Mastery and stay tuned for more content related to CPC exam and medical coding.